My name is Broome. I grew up in Lubbock, Texas, and taken a long path to get to where I am. So I did medical school at Texas Tech and residency in Louisville, and then did a fellowship in Greenville, South Carolina. So I'm a board certified orthopedic surgeon and specialize in hip and knee replacement. I did some finance for a little while and was thinking about doing stock trading and financial planning. Decided to go to medical school, and the first day I got to do orthopedic surgery, it was just a perfect match. I knew from that point on, this is what I got to do. It will never cease to amaze me in the field of orthopedics. You know, you do these big surgeries on people, in particular with hip and knee replacement that I specialize in. To do this major surgery and then go check on them a couple hours later, they're already sitting up in the chair smiling. They're walking, and they're doing better than they did when they walked in before the surgery. That amazes me, and that'll never cease to amaze me. That alone is what makes going to work fun for me. I'm a big outdoorsman. Still love playing sports when I can. Love to fly fish, try to get out on a mountain bike. Have a wife and 2 kids at home, so my real passion right now outside of work is trying to get home as quick as I can and spend every minute available with the wife and children and as much family time as humanly possible. That's where it's really at. I think there's a couple of things that the general person should look for when they're going to see a surgeon, in particular for hip and knee replacement. I think the average person in the public may not know the right questions to ask. I think number one is you need someone you can trust and build a good relationship with. And when you get, say, a hip replacement, those parts are going to be in you forever. And so it's very important that the surgeon that's treating you can develop a relationship with you and that you really have that trust, because you're going to know each other a long time. The other thing that I think that's important that most people don't know is what questions should you ask about your doctor. There are lots of people out there that do what I do and that do a great job. There are a lot of people that do a little bit of this stuff though, and they do a good job most of the time. And I think the things that you want to ask for are you specialty trained? How many of these things do you do a year? What are your outcomes, and how many complications do you have, and do you feel comfortable fixing them? And obviously there's going to be a difference in someone that does 20 or 30 of these a year versus someone that does 20 or 30 a month. I was very fortunate in my training, in particular my fellowship, to be trained in some of the new innovative knee replacement procedures. We do things through a smaller incision now, but we can really do things through a total tissue sparing approach. So we don't have to cut muscle, we don't have to traumatize muscle. The surgery then for the patient, this translates into a little bit less pain but a much quicker recovery afterwards, because the muscles don't have to recover. One of the things that was really unique to my training was learning a new approach to hip replacement. So the traditional approach is through the back of the hip. You have to cut muscles and tendons. A lot of complications associated with that, but in general it really prolongs the recovery. And it's a lot less painful because you got to have all that tissue heal before you're back in action again. By doing this with the new technique, we go through the front of the hip over by your pocket. It's a smaller incision. You don't have to violate the tissues. So for the patient, that means you get up right away, you have less pain and a lot less restrictions. And it is a game changer in this. And that is really near and dear to my heart.